Hello everybody and welcome back to my channel. My name is BB, and if this is your first time here today, welcome, and if you're back for another video, then welcome back. So today we are going to be talking about the different places that LPNs can work. Believe it or not, a lot of people feel like nowadays that if you get your LPN license that you are going to be limited in the places that you can work, mainly in a nursing home. And I am here to tell you that it is not true. LPNs can work in a multitude of different places, in a multitude of different capacities, and getting your license as an LPN is a great way to advance yourself and advance your career. So in this video, I'm going to be talking about the top 10 places that you can work as an LPN. Now, whether you are someone who is already working in this field and you are looking for a change, or if you are somebody who is already in LPN school working to get your license and you're not sure what avenues are open for you, or if you are somebody who is even thinking about getting your LPN license but you're kind of like, where can I work with this degree? This is the video for you. So if you would like to hear about that and so much more, then keep on watching. Also, if you enjoyed the video, please do not forget to give it a thumbs up. You can do it now, or you can do it later or during the video. And also, please do not forget to subscribe to my channel so you can be part of the family, as well as hit the little notification bell that will alert you whenever I post up new videos. So without dragging this on any longer, let's get into the topic of the day. So, working as an LPN, I'm gonna start with the one that I enjoy the most talking about, and that is travel nursing, because your girl is a travel nurse herself. Believe it or not, as an LPN, you can work as a travel nurse. You can work in that capacity at a long-term care facility, at hospitals, as well as a case manager. Basically, wherever there is a need for an LPN. And that can even include psych facilities, whatever your specialty is. There are agencies out there that are specifically for LPNs, and there are ones for nurses, RNs, and LPNs, and they get jobs requests put in for all of those positions. So if you are somebody who is looking into travel nursing, but you thought that that realm was only reserved for registered nurses, no, LPNs can do travel nursing too. And just throwing that out there, CNAs could even do travel nursing. With everything that was going on in the world for the past year or so, there was a great need for just healthcare workers in general, and even CNAs were able to do travel assignments. So if you are somebody who may want to get into travel nursing in the future, becoming an LPN is not something that is going to deter you from going on that career path. LPNs can do travel nursing as well. It all depends on if they need one or not. Correctional nursing. So a lot of LPNs have gone into correctional nursing, but some people are not sure what exactly is their job description. So when you go into correctional nursing, you are going to be providing direct care to inmates in a correctional facility. The main thing that you are going to be doing in that setting is performing intake exams. You are going to be giving meds, assessing your patients to determine if whatever it is that is going on with them can be handled within the facility, or if they need to go to a hospital. So having great assessment skills is a must in this type of setting. In addition, you are going to be responsible for assessing safety concerns. You are going to be giving a lot of education in regards to health promotion, as well as risk assessment. Now, if you are somebody who is scared about your safety with working in this type of environment, yes, that is a concern for any type of nursing, but there has been nurses that have said that they have felt safer in a correctional setting than working at, say, an emergency room or even working on the floor. Reason being, whenever they are working in a correctional institute, there is always a guard right there with them, by the door, beside them, in the room, whatever the case may be, there's always somebody there for them. Whereas if they were, say, in a hospital setting, they would have to call for assistance and then wait for somebody to come, and by then something may have happened to them. But correctional nursing for an LPN is a great avenue that you may want to look into, and a door that is open for you. Outpatient ambulatory centers. So LPNs work in these type of environments as well. So in this type of setting, you would be My earring just came off. Hold on. Okay, so I'm back. My earring is on. Let's continue. So working at an outpatient center, your job description is pretty much going to be dependent on the specialty and what exactly is going on. But primarily it's going to be giving and assisting. Primarily, it is going to be assisting the doctor with exams, whatever it is that they may be doing, as well as working alongside the registered nurse, and your job description will vary depending on where you are working. You may be asked to assist with immunizations, with EKGs. You may be asked to do physical evaluations on your patient's condition, as well as give basic medical care, change bandages, give medications, and also collecting specimens. So another great thing about working at an outpatient center is the fact that you are going to be only required to work 9 to 5, 8 to 6, like basically daytime hours. Some of them start as early as 6 a.m., but then you'll be out by 3 or even 4 o'clock in the evening. There is no overnight shift. There is no weekends for the most part. So working at an ambulatory center or an outpatient center has a lot of benefits, and it is a great change if you are looking to do something a little bit different, or if that's something you may want to go into, surgery and that type of thing. Working at a mental health center. So working at a mental health center, your primary job responsibility is going to mimic that of working in a nursing home or assisted living type setting. So you may be required to do patient care plans, ensure that your CNAs are keeping the rooms clean, that the facility is hygienic clean, supervising the CNAs, conducting health assessments, and also doing management. You will be required to pass out medications, to do daily assessments, make sure that your residents in this type of setting, their appointments are up to date, and those type of things. If you have ever worked in assisted living or a nursing home type setting, working in a mental health is very similar. Working at a clinic. So working at a clinic, I'm going to group together just like working at a doctor's office. So working at a clinic, you are going to be taking orders from the doctor. You may be asked to give injections, give medications, prepare the patients for exams, do intake when they first come in to gather their history, to do a basic assessment, as well as changing dressings, maybe leaving them open so when the doctor comes, they're ready to be viewed by the MD. And also you may be even asked to assist in minor surgical procedures. As an LPN, you may also be asked to do administrative type duties. So if there are medical assistants or CNAs already primarily doing the other things that I mentioned, it may be your job to supervise and make sure that they get done, to review their notes, and also to ensure that everything is running smoothly. Once again, all dependent on what exactly the physician or the registered charge nurse or the nurse practitioner may have you do in that type of setting. All right, so the next thing we're going to talk about is working at an assisted living facility, long-term care facility, as well as a rehab, because those places are grouped together, but a lot of times the job description and what the requirements are for an LPN may vary. So let's talk about working at an assisted living facility. My earring is not cooperating today, so we're just gonna give up. So working at an assisted living facility, if there are med techs at your facility, you are going to be required to be the one to pass out the medications that require further assessment. That would include administering insulin, because you would be required to check the blood glucose prior to administration, as well as medications like Coumadin, because you would have to check the INR, and also breathing treatments, since you would have to do an assessment of checking respirations before, during, and after treatments. You will also have to do assessments and also be able to determine if your resident is appropriate for that type of setting, if they are having a change in condition, if they have to leave to go to the hospital, or if they can be treated in-house. So those are the main job description for somebody who is working at an assisted living facility. So moving on to working at a long-term care facility, aka a nursing home. In that type of environment, you will be responsible for supervising your CNAs, which you would also be doing at assisted living as well. But in a long-term care facility, you would be responsible for supervising them, doing those minor breathing treatments, in addition to more skilled treatments such as wound care, setting up BiPAP machines if they are needed, as well as other things that they may need. That may include peritoneal dialysis, which I myself has set up in a nursing home type setting as well. Working at a rehab. So working at a rehab facility as a LPN, you would be asked to work with the RN in order to give and provide basic care, assisting the residents with going back to being able to do their ADLs, and you would be also responsible for passing out meds, noting any changes, and also just kind of just helping them so that they can get back to their goal so that they may be discharged from the facility. So whereas working at each of these facilities are different, they are also very similar in the job descriptions and what you are going to be asked to do. The main differences are how the jobs descriptions and the tasks are divided amongst the RN and you as the LPN. Forensic nursing. So forensic nursing is another great avenue that you may look into if you are somebody looking for a change and you are an LPN. When you work at forensic nursing, you are going to be caring for victims of traumas, of assault, and you are going to be coordinating with nursing, the investigation team. You may be asked to do counseling. You are going to be the first one to examine the patients as well as collect physical evidence of the victims of the crime while they are in the emergency room or even while they are in their home. This is a great avenue for someone who wants to assist in pursuing justice while providing healthcare and support to victims. You can get certification online into forensic nursing, or you can also get on-the-job training. But over the years, the need for forensic nurses has grown tremendously, and it is a great avenue for somebody who is looking for a change or something different than what they are doing now. Working as a wound care nurse. Working as a wound care nurse is a great opportunity for someone who is looking for a job that is very just straight, direct, and that is all they are going to be doing, which is wound care. So to become a wound care nurse, you can go about this in a multitude of different ways. You can go yourself and become certified. There are online classes that you can take to become a wound care nurse, or a lot of nursing home long-term care facilities will advertise this job and you could do on-the-job training. So you can go through it with on-the-job training, or they themselves will pay for you to go take a class so that you can become wound care certified. You can also work along a physician. I'm not really sure the official name for the doctor that comes to assess with wounds, but you can work alongside one in a facility and you can work under them to get the training that you need to become a wound care nurse. Now, this is a great job because it is very specific and the pay is... Now, this is a great job for somebody who is just, like I said, looking for something that is very specific. Wound care might just be your calling, or if you are somebody who's just tired of working on the cart, you're tired of bedside nursing and you kind of just want to do just one thing. You want to just be responsible for the wounds and the treatment of the wounds and the documentation, and that is it. But it is a great avenue for LPNs, and it is a job opportunity that is out there and open to you. Working in a doctor's office. So working at a doctor's office as an LPN, I think I kind of covered it when I talked about working at a clinic, but working at a doctor's office is great because you can work in a specialty that you enjoy. As an LPN, you can work in a managerial capacity, or you can be responsible for assisting the doctor in any minor procedures that they may need, as well as, like I said, doing intake and things like that. But working at a doctor's office is a great opportunity for LPNs, and doctors love hiring LPNs in their offices. Working as a home health private duty LPN. So whenever you work as a... So the last thing that I'm going to talk about is working in home health, working for yourself. working in private duty as an LPN. So your job description in this type of setting is very similar to that of a registered nurse, and your job description and your task is going to vary depending on the state that you're living in, as well as the company that you work for. You also have the opportunity that you can work for yourself. Now, I talked about this in a previous video, but a great resource if you want to work for yourself as an LPN is care.com. I personally have used it for myself when I was a CNA, but you can advertise your services as an LPN on there. You get to set how much you would like to get paid, the skills that you provide. So you basically will create a profile and it will match you with a family or a client that needs your services. You will meet with them, decide if it works for you, and then you guys can work something out as far as how much you would get paid, your schedule, and all that. It's gonna be up to you, but it is a great resource. Not sponsored at all. I'm just throwing them out there because I know they are a great resource for somebody who is looking to work for themselves as an LPN or as a caregiver in general. Working as a home health aide. So I worked as a home health aide as a registered nurse, but as an LPN, you would be responsible for doing dressing changes, for doing education, or whatever it is that the client needs in their home. So obviously it's going to vary what you are going to be able to do in the home, but what's great about this is the fact that you can create your own schedule, you can take on as many clients as you'd like, and it provides you flexibility. A lot of these companies also will hire you to oversee the care that is provided by the CNAs. So you would be responsible for doing drop-in visits and doing assessments if need be for these clients to make sure that they are appropriate and the care that they are receiving in regards to their care plan is appropriate for them. Private duty, same thing. You would be responsible for going into the home to make sure that the services that the clients are getting billed for is appropriate and if the CNAs are meeting their needs, once again in a managerial capacity. So that is pretty much it. Those are all the places that you can work as an LPN. If you are somebody who has worked in this capacity, please leave a comment down below. Let us know if you enjoyed it, what you liked, what you disliked, or if you just want to drop down there and tell us what it is that you do. I really hope you enjoyed this video, and I will see you at my next one. Oh, actually, my earring. Oh gosh, I forgot. What is the phrase for the end of the video? The phrase of this video is going to be sunny. Sunny, 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 because look at my shirt, it's yellow, and I had 2 yellow earrings, but now it's down to 1 because one decided it doesn't want to be in my ear twice in this video. But I still want the secret phrase of the video to be sunny. So if you completed this video, please comment down below sunny. And that is it. I will see you guys at my next video. Love you lots. Bye.